So first and foremost, the initial few periods in a female's, I mean, in the child's or the girl's age, are going to be irregular. So expect those, So she might have periods. She might just start having periods, and then there'll be nothing for next 2 to 3 months, or maybe nothing for the next 3 to 4 months, and she will keep having these periods irregularly for the next couple of 2 to 3, or maybe little more years than that also. So that is normal, because that is a time the body is warming up, to the whole system is still developing. So it's completely normal to have irregular periods in the first few years of life. So if those irregular periods continue even beyond 18 years of age, then that is a time when there could be some intervention that might be required. Now, when I say irregular periods, I say it's okay to have periods later. Maybe if a gap of 2 to 3 months is all right in between. Maybe even more than that is okay. But if she's having very frequent periods, that's a red flag sign. So if she's having periods every 15 days, every 20 days, that is something that needs to be uh, treated. Another thing is that the amount of flow. So I mean, a girl will not probably know what is normal, what is not normal. So if she's changing more than 3 to 4 pads per day, that is something which is a heavy flow. So that is also something that has to be treated. So irregular periods, meaning longer duration, longer gap between periods, is normal. Very less bleeding is also normal. If she's just needs 1 pad per day, that's fine. We don't worry about that. What needs to be looked at is if the periods are too frequent or if they are too heavy. So these are the two things that I would say are are abnormal, and that she should be evaluated for that. Another thing she is probably going to have is pain in the first few cycles, or she might have it all throughout her, every time through for her periods also. So some amount of pain is definitely normal in the early years. And initially you can give her some home remedies, like you can give her a hot water bag, or you can give some basic over the counter painkillers can be given initially for the first few years of life. There is nothing wrong. Of course, I would definitely recommend you to see a doctor if she needs to take painkillers, so the doctor can recommend these painkillers for her. But yes, don't disregard the pain. Don't say ki this is going to happen. So please, the pain is for real, so do treat it, whether it can be home remedies or whether it is some medication required. Do treat it. I've seen people, mothers saying, she's having pain, but I told her that she is going to have pain, and she misses school for the pain. Don't do that. She should not learn to think that pain is normal and I am going to have pain. If she's having pain, there is definitely something that can be done about that pain. So that is a time when you can definitely see your gynec and take some kind of medication which she might require for her periods.